Hello, everyone, and welcome to the Mock Talk with Mark Valenti and Brittany Wilson. This is our monthly session where we analyze the complexities of human communication between healthcare providers and patients using a motivational interviewing lens. Because communication is so complex, it is actually an opportunity to look at an accelerated version of the communication. So you're going to see a snippet. All of you are on mute, and I know some of you are calling in, so we're going to be talking about what is on the screen. There are handouts that are associated with this to talk about the concepts, but also some of the different elements of this particular session, which I can send out to you as well. And of course, this session is recorded. You can access this and our other sessions on our activation station on YouTube or on the Highmark Health intranet.
Mark, is that eggnog?
No.
That's about as festive as your sweater. So during the holiday season, we often think about giving, especially to those in need. We often think about people struggling with things like transportation or affording food or homelessness. We really seem to hear more about people struggling with these social determinants of health this time of year. Just like healthcare happens between doctors' visits, these types of barriers occur between the holidays as well. So today's mock talk looks a little bit different than usual. Today, we will utilize the surveyed assessment for the social determinants of health. We will take this check-the-box approach, and our goal is to make it feel more conversational, collaborative, and empathic.
Yeah, thanks, Brittany. I think that's a really good point. You know, a lot of times we want those collaborative conversations, but in this case, sometimes we have to give a survey verbatim. And as we look through motivational interviewing as a friendly reminder, that is, how do we help people change their behavior? And the typical MI approach includes the 4 elements: expressing empathy, promoting partnership, softening sustained talk, and cultivating change talk. But we're only focused today on expressing empathy and promoting partnership because we're really just trying to understand about the patient's perspective. And then from there, we can help guide behavior change once we understand barriers. We're also using the lens of drive and recognizing that, especially with social determinants of health, people are operating at a lower motivation of biological needs because they're struggling to get the basic necessities of life. We're also going to introduce a concept called engage, deliver, and evoke, which is how do we do this as a way to collaboratively give somebody a survey, regardless of what the survey is. But today we're going to talk about SDOH, social determinants of health.
Okay, so today's case study is called Holiday Humanity. What about the other times of year? And it's between Brittany, who's a care manager for Mark's insurance company, Highmark Health. She enjoys pina coladas and getting caught in the rain. And she is getting all of her social determinants of health assessments done before her vacation over Thanksgiving. She's making this phone call to Mark, who's a 46-year-old patient with a new diagnosis of diabetes. Recently, he lost his job. He enjoys eating pizza, watching the tube, and couch lounging. He has a cat, no real friends, but he does have a cousin who visits occasionally and sometimes bothers him.
Yeah, well, thanks for painting that picture, Brittany. We're actually going to tune into the conversation via telephone. Hello, this is Mark.
Hi, Mark. My name is Brittany. I'm a nurse care manager from Highmark Health. How are you doing today?
Good, Brittany. You're doing okay. I'm just sitting on the couch here watching some TV. How are you?
I'm well, thanks for asking. Anything good on?
Yeah, you know what? I just actually finished the recent episode of American Horror Story. I don't know if you watched that show, but it's pretty good this season. And we're just thinking about watching another one, and you called. What's going on?
Oh, well, actually, I have seen it, and I think it's a great series. So the reason I'm calling you is I know that you're a member with us, and I know that you've been through a lot this year health-wise, and I would like to support your health and well-being in the best way possible. I was wondering if you have 15 to 20 minutes of time to maybe go over some questions to help me better understand.
Yeah, I think that's good. I think actually you got me at a good time here today. I'm usually not even here at home, but yeah, it's between episodes. Sure, yeah, good. I'll answer your questions.
Wonderful. And I just want you to know that it's your choice to answer these questions. Some of them could have some sensitive topics, so if at any time you don't feel comfortable, feel free to go ahead and let me know.
Okay, that sounds good.
All right, let's get started. So the first questions are about relationships.
Okay, relationships. Okay.
How often, Mark, do you feel that you lack companionship?
Ooh, that's a tough question right off the bat.
Well, and your answer choices are hardly ever, some of the time, or often.
I actually, Brittany, I like to do things a lot on my own, so I don't really feel like I'm lacking in that. I don't know if that's what you mean. I just I don't really think a lot about that. So I feel like I'm doing okay. Actually, if I had somebody watching these shows with me, um, I'd probably have to pause and let them go to the bathroom and things, and I'd rather just watch on my own. So I'm doing okay with that.
Okay, so it sounds like maybe hardly ever would be the best answer here.
Yeah. If there's a never on there, put that. But yeah, hardly ever sounds good.
Wonderful, thank you. The next question is also relationship-wise. How often do you feel left out?
Left out of what?
It's not very specific, but just in general.
Yeah, when I was working, sometimes, again, like I said, I like to do things on my own. So I never really was paying attention a lot to what other people were doing. So I was actually pretty okay about doing things on my own. For the most part, I'm okay with doing things on my own. So if there's a never, choose that. But I guess you said hardly ever. So.
Yes, hardly ever. Good. Or never.
Yes.
And the final question regarding relationships, how often do you feel isolated from others?
Like I said, it's, I watch some of these, especially American Horror Story, the apocalypse season. Apocalypse meant that billions of people weren't around. That sounds pretty okay to me. So I feel actually pretty okay.
So the never that's not there, but the hardly ever.
That's right.
Okay, wonderful.
At least these questions aren't so bad.
Well, the next question's a little more personal. It's about finances.
Oh, okay.
Yeah, so sometimes people find that their income does not quite cover their living costs. I know that you mentioned when you worked.
Yeah.
So in the last 12 months, has this happened to you?
Okay.
And the answers are yes, no, don't know, not applicable, or again, you can choose not to answer.
Okay. So, which part are you asking about specifically? I know first of all, I appreciate your patience with me. I'm trying to, answer the questions, and you talk about work. It makes me, you're right, a little sensitive. So if you don't mind repeating the question, I really would appreciate that.
No, I don't mind at all. So sometimes people find that their income does not quite cover their living costs. Mm-hmm. So since you've lost your job in the last 12 months, has this happened to you?
Yeah, after I lost that job, it's it's been rough. I had to kind of really think about things. I like obviously I like cable, so that's kind of important to me. But there's other things I kind of had to give up. Going out to eat as much, and maybe putting the thermostat down a bit more. So just trying to save some money. So it's been rough sometimes to try to balance what I need to feel normal sometimes.
Losing your job has really impacted you.
Yeah, it really has. And, at first I was like, oh, I got all this free time. But yeah, sometimes it's pretty rough, especially stuff I took for granted before covering that.
So it sounds like it definitely did have an impact on you. So I think maybe the answer to this question is probably yes.
Oh, yes, I'd say so. Yeah, definitely yes.
Well, thank you for elaborating and opening up there.
Okay.
All right. So the next question I have is kind of about how you understand your care plan or your conversations with your doctors. How often do you need to have somebody to help you when you either read instructions, pamphlets, or other written material from your doctor or pharmacist?
Oh, you mean can I read? Can I read?
That's basically the question. Or, some people can read, but everybody reads at different levels. So, and sometimes medical jargon is difficult to understand, and not everybody does a good job of explaining it. Mm-hmm. So, it's really just making sure that you're able to understand everything that's given to you. Yeah. So the answers here are never, rarely, sometimes, often, or always.
Yeah. So, the question was, how often do I need help? Actually, I'd say
Hardly ever. I'd say hardly or rarely. Actually, I used to, believe it or not, work in healthcare. So a lot of times I get what they're saying. So I'd say I don't really struggle with that at all.
Okay, so you did say rarely, and I noticed you didn't say never. So out of all of that, could you provide me maybe with a little more elaboration on maybe some of those rare times that it does happen?
Yeah, so I think good catch there. I used to work in healthcare, and there's always somebody who's gone to school, some doctor, some nurse, and they like to maybe sound a little smart, so they want to share all this big words and things like that maybe I don't always know, but for the most part I get what they're saying. So that's why I don't want to choose never, but there's occasionally times whenever I feel I may not know everything, and I probably maybe would need a little bit of help.
That's fair. Thank you so much for taking the time to share that. So the next questions are about food.
Okay.
And I know we talked a little bit about just struggling with living things and some of the things you've given up. So within the past 12 months, we worried whether our food would run out before we got the money to buy more. Is this often true, sometimes true, or never true?
Well, the last 12 months, if I go back 12 months ago, I was doing fine. Like I said, I was eating out when I wanted to. Since I lost my job probably beginning of July, I really started thinking about, do I need to save up my money or not? At first it was stop going out, but this is kind of tough. I think, there's sometimes when I have to say, all right, I'm going to see if there's a special at the Pizza Hut down there. They have a special night where you can buy pizza for $5.99. I'll end up getting it on that night for dinner, and then saving it the rest of the time for the next day. So I really got to make my dollars count sometimes. I'm not starving on the street or anything, but I definitely sometimes worry about it. I'd say sometimes.
Okay, so that's sometimes true.
Yeah.
And it sounds like you've been kind of rationing and spacing out, and it's been a worry to you.
Yeah. Okay. Oh man, yeah.
Well, and again, I just want to remind you that you have a choice in answering these. I know that some of these topics can be a little bit uncomfortable.
Yeah, I know. I just don't like to, like I said, I like to keep on myself a lot, so I don't like to necessarily share all this. So, but thanks for letting me share some of this stuff. It's actually kind of good to talk about it with somebody.
Absolutely, my pleasure. The next question is also about food, and it's worded very similar. And it's within the past 12 months, the food we bought just didn't last, and we didn't have money to get more. Is this often true, sometimes true, or never true?
Yeah, I would say that it's probably never true. So far I've been okay with rationing. I think you said the word rationing. I've been okay with that, especially over the last 12 months.
All right. So you have been able to ration, but you've not really run out.
That's right.
Okay, that's good to hear. All right, so the next question is kind of about your transportation.
Okay.
Has a lack of transportation kept you from medical appointments, meetings, work, or from getting things needed for daily living?
You know what, my car, I just paid it off probably last year. It's, fairly new, paid that off, so thankfully I don't have to worry about car payments. So I've been okay with that as far as that's concerned, as far as things. And like I said, normally I'm actually out driving around somewhere going to, maybe the library and things like that. I've been able to make my doctor's appointments. That of course I have a little bit of problems with my blood sugar and, the diabetes a little bit. And, but I've been able to make those appointments. So far so good with that. Cross your fingers, right?
Yeah, you could look at it that way for sure. No, thank you for sharing that. I'm really glad that you're able to, at least have that and that it's paid off. And that's one thing that you don't have to worry about.
Yeah, thank you.
So the next questions are about safety. Do you feel safe in your neighborhood?
Oh, yeah. I live over in Bloomfield, and I've been here all my life. My family's from here, and really know the neighborhood. Like I said, I like to keep my distance, of course, but I know that no place is perfect, but I actually, I feel safe in my neighborhood.
Well, that's great. Are you afraid of anyone close to you?
What do you mean by that?
Does anybody around you or in close proximity, maybe in your home or just somebody that you see frequently, cause you to feel unsafe in any way?
Oh my gosh, no. First of all, it's just me in my home. I don't feel unsafe in any way like that. Like I said, I know my neighbors. I know occasionally my cousin stops over just to say hi, but can't tolerate him for that long. But he's harmless. I don't feel unsafe at all.
Okay. The last two questions I have for you, I know you mentioned you lived alone, but they're actually about housing.
Okay.
All right. So in the next 2 months, are you worried you may not have stable housing that you own, rent, or stay in as part of a household?
That's a good question. Like I said, this is my parents' house before this. But it's been around for a while, and I noticed as it gets colder outside that some of the ice is freezing on the roof, and I think that I need those gutters cleaned. And I noticed there's some cracks that start to happen, and like I'm thinking, how much is that money how much is it gonna cost to fix that? It's that part of it. Then I also worry about the taxes, right? So I'm gonna pay those taxes, and those aren't going away. So I'm not overly worried about it, but as time goes on, I don't have a source of income. I really wonder about what the heck is going to happen sometimes. Even something little like that could throw me off.
So you're worried about the maintenance costs possibly impacting you having stable housing.
Yeah, absolutely. Especially as it gets cold in here, and you always hear about foreclosures, and I'm not so much worried about any of the mortgage and things. Like I said, the house is paid off, but it's these extra taxes and things that I don't want to kick out my house for something like that.
Yeah, that's a fair worry.
So I'd say I'm definitely worried about that. Probably more than I even realized.
Well, and I think it shows a lot that you're kind of thinking ahead of potential things.
Yeah.
So you know a lot about house maintenance.
Yeah.
The last question is also related to housing.
Okay.
In the past 12 months, has the electric, gas, oil, or water company threatened to shut off services in your home?
No, nothing like that. As I try to prioritize, I definitely, none of that's happened. Like I said, I was actually trying to keep my house cooler than I had before, and really try to conserve. So, and they never actually did anything. I want to avoid something like that altogether. But like I said, as I start talking through all this, it does seem kind of overwhelming, the amount of expenses that I may have now. I don't know. You said before there's something that maybe you can help with some of this. I don't really know what to do sometimes with some of this.
Yeah, no. And thank you for giving me the time to kind of go through those questions. I know that some of them were kind of difficult. We might have uncovered some things that you may not even have, brought to the surface. So thank you for taking the time.
No, thank you.
I know that we addressed a couple things, and you did have a couple potential concerns that may have been more important than others.
Yeah.
So out of everything that we talked about, where would you like to focus, or what concerns you the most?
Oh, yeah, that's a lot, right? I feel like I've been a responsible person through my life, kind of save money up and, conserve when I can conserve. I know we talked about food. I know we talked about worried about the house. I think probably the food is probably the most immediate, because some cracks, taxes, that sort of stuff. But day to day, you got to eat, right? And I don't want a situation where I'm buying a pizza for the whole week. And, that's important. So I'd say the food probably is my biggest thing that I worry about.
Yeah, no, that's a fair worry. And, thank you for taking the time to kind of focus that for me. And we can absolutely help you with that. Would you like to partner with us to help you explore some of the options that we might be able to present to you to kind of help you through this hard patch?
Yeah. Brittany, like I said, as you heard, I'm not always a big fan of being around other people or even asking for help. but it's tough, and I'm not an easy person to get along with. But any help you can give me, I'd be open to it. I think.
Yeah, absolutely. I'd be happy to connect you with the resources that we have. Okay.
Okay, great.
Well,
That's great.
Mark, it was a pleasure to talk with you on the phone. Would you like those resources mailed, via postage, or do you have an email that I can?
Yeah, you can. Do you have my address there? And yeah, I definitely want to maybe look that over. But what happens if something happens? Like, how do I reach out? What happens?
Well, and that was the other thing. I was going to offer you my contact information. So if you had any other thoughts or questions, you'd like to reach back out to me, I'd be available.
Yeah, that'd be great. Yeah, just if you give that to me, I'm glad to talk with you about it. And that didn't seem that long ago today.
Oh, well, good. I'm glad that we were able to talk through it. And just for your future, my number is 867-5309.
Okay, great. All right, thanks. I got that down.
All right.
All right, thanks.
Well, if you need anything at all, again, my name is Brittany. Feel free to reach back out, and I look forward to checking up to see how things are going here within the next month or two.
Okay, thanks, Brittany. I'll talk to you later.
All right. Thanks, Mark. Bye.
Thank you for joining us for the mock talk today. We hope it gave you an opportunity to see a framework for when you have to give a verbatim survey, and an opportunity to continue that promoting partnership and collaboration. For Brittany Wilson, this is Mark Valenti signing off. Have a fantastic rest of your day.